concerns have been raised about whether the number of reported new COVID-19 infections is actually a true reflection of the situation on the ground. This is after the looting in 2 provinces, which affected service delivery and ultimately making it more difficult to get a proper COVID test. The National Institute of Communicable Diseases says most parts of the country appear to have reached a peak of the 3rd wave. Well, the National Coronavirus Command Council is expected to meet this weekend on the way forward, which leads to a question about whether the current restrictions will be relaxed. We're joined now by Professor Bruce Malado from the Gauteng Coronavirus Command Council. Professor Malado was the person who analyzes and predicts the numbers. He's a mathematical modeler. Professor Malado, good evening to you, and thank you very much indeed for your time on the Pulse tonight. In Gauteng, do you believe that that province is now over the peak number of infections?
Hi, Stephen. Thanks for having me. So what we have been observing for the past 2 weeks is that the numbers have been on the downward trajectory pretty much in every single district and sub-district. However, as of the end of last week and beginning of next week, we basically started feeling the effect of unrest in some of the sub-districts for which the numbers and the risk was not going down. Now, it looks like the second half of the week that just started seemed to indicate that the numbers and the risk indexes in also those sub-districts that had undergone unrest seem to be going down as well. So right now we appear to be on a solid trajectory and a solid downward trajectory where the peak was reached around the first week of July.
So we're now 2 weeks later after that. Are we still in the situation where we're likely to have the highest number of hospitalizations because they lag the number of new deaths? Do you believe that perhaps now, or maybe we're already over the worst of the situation in our hospitals?
You're absolutely correct. The pressure on the hospital system still is tremendous. As of yesterday, we had about 8,600 patients due to COVID in the hospital system of Gauteng. That's slightly below the 9,000 mark that was crossed the way before, and it's certainly not going down fast enough. So the pressure on the hospital system is still very, very high.
Are you worried that this wave is now moving to other provinces, or are the other provinces going to follow Gauteng's lead?
We typically don't comment on the situation in other provinces. We let the corresponding stakeholders do it, but we do, of course, pay a lot of attention to what happens around us. So in a number of provinces, such as Northwest or the Northern Cape or the Free State, you can clearly see that the risk indexes and the level of risk is decreasing, while, of course, it remains in the high risk area, like in Gauteng. We also seem to see signs that Limpopo and Mpumalanga are leveling off, and that's, of course, encouraging. So certainly what we see in this 3rd wave, because of a number of circumstances, is that each province is sort of like its own ecosystem, and it has its own life. So it's clear that the pandemic has behaved very differently in different places and different provinces.
It's fascinating because we know that these cases in this wave have been driven by the Delta variant, which we understand to be more highly transmissible. I imagine there's still a lot of science of why exactly the Delta variant is so much more transmissible.
What we do from the modeling standpoint and also in collaboration with experts is to really evaluate the details of how the numbers evolve in time. And what we saw in Gauteng was a clear effect of the emergence of the Delta variants that became dominant around mid-June. So in the beginning of the pandemic in Gauteng, the beginning of the 3rd wave in Gauteng, we saw a relatively mild increase and mild acceleration in the numbers, but as soon as the Delta variant became dominant, we saw a sharp increase in the numbers and a strong acceleration, and it was an exponential process. So we understood post factum that it was the Delta variant that was driving it when we found out that it had become dominant.
You've told us before, and other doctors and scientists have told us before, how if you'd had another variant, so if you'd contracted COVID-19 in the 1st wave or the 2nd wave, say over the Christmas period or last year, you would have had the Beta or the Delta, the 1st variant. But now the question was, could you get the Delta variant if you'd had the 1st variant? And the answer was yes, but we don't know how many. Do we know yet how many people have had the disease before and still got the Delta variant? Is it possible to even begin to do that maths yet?
Indeed, we do it all the time because we really have to understand where we are going and what the size of the peaks will be. We're now already crunching the numbers to understand the characteristics of the fourth wave in light of the fact that by then a significant fraction of the population will have been vaccinated. So yes, we certainly do it all the time. We take into account the probability of reinfections. We take into account the composition of the virus. We take into account all those things in the model.
Obviously, there's a National Coronavirus Command Council meeting this weekend. I don't know if you'll be able to tell us if you're making any recommendations as part of the modeler for Gauteng. But are you expecting any significant changes? Let me put it like that. You can nod twice for yes if that's politically easier.
So what we do, what our committee does, we report directly to the command center of the province, and based on those recommendations, based on those statements that establish where we think we are in the pandemic and what are the risks, then obviously the Premier takes that to cabinet for discussion. So we typically don't discuss what we think policymakers should do. We don't want to put pressure on them. What we do is we basically are as upfront and candid as we possibly can in terms of what we think the risks are.
Professor Bruce Mulatto, I appreciate the honesty. Thank you very much indeed. He, of course, from the Gauteng Coronavirus Command Council, one of the people who makes the mathematical predictions so far, pretty much on the money.